Hi there, everyone. Thank you so much for joining us today. We are going to be talking about the rashes in kids that you need to be concerned about and how to recognise them and where and when to seek help. My name is Sarah Hunstead. I'm a paediatric nurse, a mum of two, and also the founder of CPR Kids. And I'm joined by the fabulous paediatrician, Dr Deb Levy today. And we are coming to you from Gadigal and Bidjigal land today. And it is certainly wet where we are, but certainly not as wet as a lot of places in New South Wales and Queensland. You know, we're certainly thinking.
I know, Sarah. I keep on like wanting to complain and then thinking, actually, I can't. I mean, even with the reason we're late, by the way, is Sarah's garage actually just flooded. So hopefully some of you have hooked back on and logged back into this because I'm sure it's going to be a helpful session. But you're right. I hope everyone out there is keeping safe. And I just feel so bad for people who are out of their homes or lost their homes. And, and obviously the fatalities are just heartbreaking.
Yeah. And also I think the thing is looking through your social media at the moment, there are lots and lots of ways that those of us who are not in those areas can actually help. And one of the big things that I'm seeing is that it's not helpful just to send our spare stuff and everything randomly. It needs to be a lot more coordinated than that. So have a look through your socials, go to different charity websites. There are lots of ways that you can actually help. So just spend a little bit of time seeking that out and you'll find really good and effective ways to do so. Okay.
Absolutely. Okay, so should we dive into our session today? Dangerous rashes.
Okay, I'm pulling my sleeves up for this one.
Exactly. And I'm going to apologize exactly as I did last week. I'm now in my office with two dogs, so there might be a little bit of noise.
It's all right. We work with kids and adults. Good thing.
Okay, so I think, we haven't even introduced ourselves. So we're here with the wonderful Sarah, who usually introduces me. So I'm going to do the job of introducing her today.
Oh, thanks. Go for it.
The wonderful Sarah Hunstead, who is the founder of CPR Kids. And if you guys haven't taken one of her courses, you really ought to be. CPR, basic first aid, is so essential for every single parent and caregiver. But anyway, there's a little plug for you, Sarah. But no, honestly, Sarah and I have worked together for many, many years, back at the children's hospitals. And it's just so wonderful to continue our relationship in this format, because I know that both of us really love educating parents and caregivers and, really just cutting through all the noise out there, cutting through, the Dr. Google rubbish and really just giving you what you need to know in order to help your children. So my name is Dr. Deb. I'm a holistic pediatrician and we're both mama of two girls. And Sarah usually has some stories to share with us. So let's see, but hopefully not today because no one wants one of these kind of rashes.
I do. But
oh no. Okay. So I think the two main rashes, I mean, look, Sarah and I were chatting about this before, and I kind of said, look, there's so many rashes that to me as a pediatrician make me go, oh, something's going on. I'm worried about this. There could be something serious. But really, that's just like, down the rabbit hole, and it just becomes too technical. So really what I wanted to do here is give you the skills to know which kind of rash you should be calling an ambulance for. And then the rest of the rashes are not up to you to diagnose. Even these ones aren't. It's just for you to be able to hopefully upskill yourself in recognizing them and knowing when to call for help.
Yep, exactly.
Should we screen share, Sarah, so then I can just show?
Yes, you go for it, Deb.
Okay.
Yep. It might take a little bit, but I think just highlighting what Deb was saying there, that you don't need to diagnose what's going on. And when I do tell my story, that will definitely be a big part of just recognizing, and it just highlights the fact that you just need to recognize this. If you recognize it and seek help, that's the important part. Okay, there we go. We've got this up now. Fantastic.
Okay. So as I've said here, it's what you need to know and when you need to worry. So the two main types of rashes that I'm going to cover here are, firstly, the allergic type rash. And all I'm going to do is show you a couple of images because really Sarah and I chatted about this last week. So maybe, Sarah, we can just link to that session in the comments below. And please go and have a look at that video that we did. So this is an urticarial rash on a lighter skin and on a darker skin, indicating allergy. I'm not implying that all urticarial rashes are an emergency. It's just a part of what could evolve into an emergency situation, i.e. anaphylaxis or a serious reaction. So please go ahead and listen to that talk. And that's also, again, just part of allergies. You'll see these exact images there with a lot more description. So I guess the most important rash that I wanted to show you is this one here. And you know, most of us have heard of, you know, and you know, comment below if you're confused with this terminology, but the difference between a blanching and a non-blanching rash. And essentially what that means for us is whether or not the rash fades when we press on it. If it does not fade, that is a more concerning rash. That is what we are then starting to call petechiae or purpura. And what that usually indicates is bleeding under the skin, or inflammation of the vessels, or septicemia. And it's the septicemia that really is, you know, the emergency part of this rash and this dangerous rash. You may have heard of things like meningococcal or pneumococcal, and, you know, there certainly are other bacteria that can cause septicemia with these kind of rashes, and it can evolve very, very quickly if it in fact is. So I'll just show you this little video that is from PR Rapid, but I just thought it illustrated it really well. And can you see how that does not go away?
Mm-hmm.
Sarah, are you seeing that nicely? And you can either use your finger or a glass. And essentially what that does is it just, sorry, I'm just trying to get out of YouTube now. Oh, is it not working? Sorry, guys.
That was
sure. Yeah, so let me just go back onto this. And this is what it looks like, you know, when you're actually just looking at it and not pressing on it. So you can see here, it's red, it's dark, varying sizes as well. And you can see here on the lower limbs, this is just on the trunk. And, you know, really that is what we call either petechia or purpura, depending on the size. So I'm just going to go on to the next slide, and then I'll flick off the presentation. We can chat a bit more about it. Because here, what I want to make the comment about is, you know, looking beyond the rash. And I wasn't just being facetious by putting an eye in there or cheeky. I actually wanted to show you that, which is the subconjunctival hemorrhage, and make the point that there are many, many causes for those kinds of rashes, so petechia and purpura. And it's about assessing a child as a whole. And I'll come into this in a second, because these are the other things as clinicians and also as parents that, you know, you should certainly be aware of. And it helps indicate what the cause of the rash is and how much of an emergency it is. You know, we look for things like fever, vomiting, headache, photophobia. That's when your child doesn't like bright light. It actually hurts their eyes. Those kind of things will indicate a meningitis, which I'm sure you're familiar with. It's an infection of the covering of the brain and central nervous system. Nosebleeds, general well-being, aches and pains. Then we start worrying, you know, is this possibly like a blood disorder? Could there be, you know, something sinister underlying that, you know, something, you know, like leukemia or, you know, so I think that, you know, the message I want to give is, you know, not every single rash like that, you know, is meningococcal, pneumococcal. You know, the other common thing I just wanted to say also about that kind of rash is that it can just be, and the subconjunctival hemorrhage, it can just even be from something. And this is where it gets confusing. And Sarah, I'm not going to overwhelm you with information, but I just want to mention that even simple viral gastro, if your child has been vomiting and vomiting and vomiting and vomiting, they can actually get a few of those spots, usually from like the nipple line up, and, you know, maybe even some bleeds, and that's from increased pressure. But again, this is not your job, you know, to be diagnosing it. It's just to be aware of, you know, what that rash looks like, and that you need to seek urgent review. How do I stop screen sharing? Let me just do this. Sorry.
I can help with that. There we go.
Okay. So, you know, in a snapshot, I guess I just wanted to identify what the blanching versus non-blanching is, and really it's the rash that does not go away that makes us worried. And
Yes.
depending on all the other symptoms, makes us think this is a medical emergency. Your child needs antibiotics, ASAP, or we need to delve further and look into why your child has this rash. You do the both. You do that for the first one as well. But yeah, am I explaining that clearly without?
I do. Yeah, I think you have. And I think one of the important things to go is sometimes we can be focused on looking for a rash. Certainly in my experience, and I have no doubt in yours too, Deb, that kids who have had, septicemia or, and so on have often become quite sick before the rash even appears. So, sometimes that can be indicative, and that's maybe what you notice, but usually you'll notice a really sick kid with all of those other symptoms beforehand as well. And so I guess what we're trying to say here is these are concerning rashes. You need to seek urgent medical help if you see these. You don't need to diagnose it. It may be of no consequence at all, or it could be something serious, but you don't have to decide that. Leave that up to the doctors to sort that out. And I think one of the important things, of course, is remembering that they don't necessarily have to have a rash to be really sick as well.
Yes.
And
yes.
I've got a couple of stories, if that's all right, Deb. I think
Right.
exactly, what you just said. So first of all, my older daughter, every time she vomits for Australia. Seriously.
There you go. So it's that forceful vomiting. Yeah.
Oh, yeah, it's just her. It's like her head is going to fall off. Not really. But she will get petechiae, those little spots all around her eyes every single time.
Exactly.
I know that. I look at her and I know that's okay. But there has been a time when she was a lot younger, she was vomiting, but she also had these spots all over her legs. And that was very concerning because I'm like, this is not what normally happens. She now has these petechiae over her legs, and she went straight to the emergency department where she was seen very, very quickly. She was fine. We still don't know what caused those spots, but it wasn't anything we needed to be concerned about. But as a mum, and even though I was a nurse, what I knew was this is not right. This is different to normal. These spots aren't going away when I press on them. She needs urgent medical help. So that's what we did. And, then, of course, you get my other daughter who the other day, and I'm not joking, and she's too old to do this, but she just wasn't concentrating. She had a new drink bottle with a really wide neck on it. It's got quite a wide neck. So she put it over her mouth and went to a drink and sucked too hard, and it ended up stuck around her. And instead of waiting for me to go, stop, we'll just ease it off, she just went like this. She ended up with the petechiae all around here. It looked like she had a mustache. Yes, I photographed it. I can't actually find the picture at the moment, but should put it up.
Certainly, like trauma is definitely a cause of petechiae, and that can even just be like a ringing kind of trauma like that, and again, then it's the pattern of the rash. It's pardon?
Across here from a backpack, I've had that.
Yeah,
when I've been
exactly.
Time across there, petechiae from the shearing forces.
Yeah. But then you're talking about an otherwise totally well child, and that's why it's looking beyond the rash and seeing a child as a whole.
Exactly, that's right. And that's, I wasn't concerned at all. I knew what happened here, around my child. That was just silly. That wasn't.
And we all allowed a couple is the way that I look at it. We all allowed a couple of petechiae. We probably all got it ourselves if you really looked. But it's got to do with with the big picture. And I think certainly, I always think err on the side of caution. It's a little bit different, obviously, for Sarah and I, because we're professionals and we've got that knowledge in our heads. But I just think that if you see this rash, it's non-blanching, talk to someone about it. And by someone, I mean a health professional.
Yes, absolutely. So whether, if they are obviously unwell with that, then you're seeking more emergent help. But if they are looking reasonably well, you're not too concerned, but they might have a few spots, why not even call Health Direct? Speak to them, or why 1-3 Health, whatever, or Nurse on Call, whatever is in the state that you're in, and ask advice. You might do a telehealth session with a GP, but of course, and I think this is the biggest thing that I've taken away from what Deb has said today, is that you need to take that step back, look at your child as a whole. So, and remember, they can still be sick without a rash. They can be not sick with a rash. Let doctors decide.
Just to keep us on our toes.
Exactly. That's exactly right.
Yeah.
Very good. Anything else you want to talk about?
Take any questions if anyone's managed to stay on for this live and has some questions. Sorry, my dog's going a bit crazy here.
Excellent. Oh, we'd love to see the puppy. Can we see the puppy, the new puppy?
Yeah, show them. Yeah, the 10-kilogram big dog's a bit heavy for me to pick up, but I'll pick up my puppy.
Yeah, show us the puppy, Deb. And of course, everybody who's watching at the moment, please tag anyone in the comments below who you think needs this good information. Oh, look at her. She's gorgeous. Is she
cheeky? Sorry?
Yeah. Is she cheeky?
Oh, yeah, she's a cheeky one.
Oh, she's gorgeous.
That's so sweet, though.
Yeah. Oh, yeah. How could you not just melt when you look at her?
I know, right?
Yeah, exactly. Of course, the other thing that we want to is that please let us know what you would like us to do. Okay, so please make sure that you post in the comments or DM us. That's probably a better way, because if you're watching this a week later, we're not going to see in the comments if you've asked us for something. So please DM us. Jump on Deb's Instagram as well, and also the CPR Kids Instagram. Message us through there. We would be absolutely delighted to bring you the information that you want. So thank you so much for joining us today, Deb. I don't think they've. Oh, hang on. We do have
like a little teddy bear, Melissa. I agree.
And Natalie has said, just wanted to say thank you. I only just learned about these different rashes recently. Great to have it explained. The cute puppy. Good. I hope it's been really helpful, Natalie. Definitely helpful. And yes, isn't she gorgeous?
Little Miss Lulu, her debut.
Yeah, exactly. Yeah, Lulu might have to become a fixture on here now. What do you think?
I think Millie's better behaved, or Molly.
Yes, exactly.
Your dog, Molly.
Molly's just laying down here, so there we go. I know, all good. So
thanks everyone. And I think next week, are we doing?
I will tell you exactly what we're doing next week. We are talking about burns first aid. So we're going to be talking about prevention, recognition, and response to burns in kids, and also things to put in your first aid kits for burns that you might have never thought of that are really, really handy too. So make sure you tune in and watch. And if you can't watch, then you can watch it on our pages at any time. Okay.
Thanks for joining, everyone.
See you later.
Bye.